So thanks very much for joining this morning, and welcome to the Consultative Committee webinar number 3, Health and Wellbeing of our people. So really looking forward to having a discussion, particularly the panel discussion as we carry on today. So just a little bit about myself. My name's Stephen Moore. I work for the North Australian Pastoral Company as a General Manager, and part of my role is to work in the area of people and health and safety and wellbeing. So personally, I've got a particular passion for this area, and I've really sort of found it very interesting making an application to agriculture over my time so far at NAPCO. So that's a little bit about myself. We've got a business that operates predominantly in Northern Australia through Queensland and the Northern Territory. So we won't be able to introduce each other as we go around like we normally do at these forums, but do please use the chat function, introduce yourself. You can also change your display name to include who you represent. You can do this by clicking the 3 dots in the top right of your video. Just some quick housekeeping. This is a panel webinar, but set up as a meeting so people can talk if required. For that reason, please remain on mute until invited to ask your question. Please note that this webinar is being recorded. The chat is also being recorded. This includes any private chats sent. So I've only just learnt that today. So just be careful with your private chats there. I know everyone will. And we'll be finished by 11:30 this morning. So just the 1 hour. Just a little bit on the agenda. I'll give a little bit of an introduction about some of the areas of focus that the framework has been focusing on over the last 12 months, and then we'll have a panel discussion, which I think everyone will find really interesting, and we'll introduce the members of that panel shortly, looking to wrap up just before 11:30. So just a quick introduction. Working environments vary considerably between farms, feedlots and processors. Within the industry, work health and safety procedures, practices and incident rates differ significantly by sector. Australia's red meat processing sector has well-established work health and safety procedures, systems and practices to protect its workforce. Farms are unique business environments. Producers face the highest risk to life across the industry, managing plant, chemicals, noise, dust, sun exposure, animals, and for many, solitary work or work in remote locations. Additionally, farms are often both workplaces and residences, which can leave family members exposed to hazards. Safe Work has identified agriculture as a priority industry in its work health and safety strategy from 2012 to 2022. In our 2020 annual update, the data told us there were 7 deaths on farm during 2018. This data has been extracted from Safe Work Australia's Traumatic Injury Fatalities database. The industry is aware that fatalities are a very limited indicator for health and safety, and through our materiality review, we continue to investigate further measurements. The 2018 Regional Wellbeing Survey indicated that those living on farms and feedlots had a global life satisfaction index of approximately 76. This index measures life satisfaction on a scale of 0 to 100. A low score is less than 65, while a high score is 85 or higher. Australia's average score is 73. This figure indicates that producers and lot feeders are, in general, above average in life satisfaction. Many farmers find the work they do rewarding and fulfilling. However, farmers also face many pressures that are out of their control, such as drought, natural disasters and trade shocks. When prolonged, these pressures, coupled with the isolation of rural life, can have a real impact on the mental health and well-being of farmers and farming families. This fact is even more relevant in the midst of the COVID-19 pandemic. Prior to today's webinar, we asked just a quick survey, and you can see the results there. So for the first question, have you got a business program for workplace health and safety? But a pretty unanimous positive response to that. So most respondents said that they did have some kind of program or structure in place around workplace health and safety. And I guess what's interesting is around mental health programs, the numbers were a lot lower. So there's only about half of the respondents having a specific plan in place for mental health programs. And we'll talk about that with the panel as we go forward today. Overwhelmingly, most of you are likely to embrace change in your business, which is a positive insight into how people treat the serious nature of health and well-being. Because a lot of this It is a change in mindset. It might be a physical change, it might be an operational change, but a lot of the progress in this area does involve being open-minded about change, and really be interested to get some thoughts from the panel on that once again. So I'd like to briefly welcome our panel members for today before inviting them to formally introduce themselves. So first up, we have Pip Job, who is the Director of Engagement with the New South Wales Department of Primary Industries and has experience in the field of resilience, social capital, community engagement, natural resource management, and sustainable agricultural systems. Pip, we would love for you to give us a brief introduction to yourself and your experience with health and wellbeing of people in the agriculture industry. Thanks, Pip.
Thanks, Stephen. Good morning, everyone. As introduced, I'm with the New South Wales Department of Primary Industries, and I was part of the steering committee that formed the Beef Sustainability Framework. And I've had, I guess, a bit of a career that's looked and focused in on what are the features that make a resilient farm family business unit. And I've done that through not-for-profit sector, being involved in land care as a beef cattle producer, and now in my role with the department. 2018, I was the New South Wales Drought Coordinator, and I've got teams that have been helping primary industries recover from, well, deal with still and recover from the drought, from the recent bushfires, and now our pathway through COVID and all the challenges it brings. Looking forward to the conversation.
Thanks a lot, Pip. Certainly sounds like you've had a busy time with, particularly with the COVID response. So thanks very much for that. Next up, we have Prue Bondfield, who was once the chair of the Australian Beef Sustainability Framework Steering Group. Prue, if you wouldn't mind following up Pip with a brief introduction and your experience with workplace health and safety at Palgrove. I think you might be on mute there, Pip. Prue, I think you're on mute there, I think.
Sorry about that. Steve, can you hear me?
Yep, all good now. Thanks.
Hello
thanks,
to everyone, and thanks very much. As you said, I was the inaugural chair of the Beef Sustainability Framework. We ran a family business in southeast Queensland across New South Wales properties and Queensland properties, and we were a family operated business until 2017, when we had an investment from the New Zealand Superannuation Fund into our business. So I guess we transitioned into a sort of a corporate family enterprise, and that brought with it a whole lot of challenges, particularly in the areas of workplace health and safety reporting. So I guess I've seen both sides of family-owned business and corporate, and have learnt a lot of lessons that I hope to pass on today.
Thanks very much, Prue, and it's certainly great to see both yourself and Pip as former members of the steering group remaining involved in the framework, and it's very greatly appreciated. So we're fortunate to also today be joined by Dr. Tim Driscoll from the Royal Flying Doctor Service. Tim believes remaining connected to others is essential to our health and wellbeing, and has helped launch campaigns such as the Small Talk, Big Difference campaign. Tim, please introduce yourself to the attendees and just give us a bit of an insight into your role at the RFDS.
Sure. So I'm Tim Driscoll from the Royal Flying Doctor Services Outback Mental Health Team. We've got 3 services operating across Western Queensland. We've got the Drought Wellbeing Service, which is specifically tailored to assist people impacted by drought, and that is very much producer focused. Although we do offer services to people in town, obviously they're also impacted by drought, but there has been a large producer focus in that program, mainly because mental health services have been very poorly uptaken by people off the land generally. So I guess that was a gap that we were trying to fill with that program. We've got the Remote Wellbeing Service, which is our fly-in service, so where we put a mental health clinician in with our doctors and nurses when they run clinics in smaller towns. And then we've got the Wellbeing Out West program, which is entirely funded by charitable donations. And that's very much about mental health promotion and events and training. So they operate mainly across Western Queensland and service people in those areas. So they're the programs that we're running in Western Queensland. And I'm from a rural background myself. And so some of my team are also from a rural background. We've got a bit of a mix of people on the team. But the incredible thing has been the uptake of service, particularly with our newer program with the mental health clinicians flying into towns, very small rural communities, and the uptake has been really quite phenomenal. So that's been something that has gone better than expected, which is really promising, I think. And I guess that's enough for me for now.
Thanks a lot, Tim. We appreciate that. And last but not least, I'd like to welcome Morna Semmens from the National Centre for Farmer Health. Morna plans and delivers quality care AgriSafe clinics to farmers and agricultural workers, and also delivers health and lifestyle assessments at agricultural field days when they were on pre-COVID. Hopefully we get back to some of those pretty soon. Thanks, Morna, for joining us, and we'd love to hear a quick introduction, a bit more about what you do.
Oh, thank you, Steve, and to the Beef Sustainability for initiating the event. Health and wellbeing of our people, really important topic and a great opportunity to hear about how our agricultural community is working together in these areas. I'm representing National Centre for Farmer Health. We're a partnership between Western District Health Service in Hamilton, Victoria and Deakin University. So if you don't know about National Centre for Farmer Health, we provide a range of services across the nation, and indeed our reach goes international as well. I'd encourage listeners to visit our website, but briefly our key objective is to increase knowledge transfer across target groups of farmers, rural professionals, academics and students. And so we do that in several different ways. We do it by education. We offer a unique graduate certificate in agricultural health and medicine in conjunction with Deakin's University School of Medicine. So we also are involved in applied research to improve the evidence base around prevention and early detection of risk factors in agriculture. And we also engage in advocacy and partnerships with government and corporate entities with the goal of making a difference to farmers' lives. So I can talk a little bit about some of the different ways that we do that as we continue the webinar. I guess my role predominantly at the centre is as a registered nurse. My current role is as an AgriSafe clinician. So that involves empowering farm men and women and agriculture workers to improve all aspects of their health, their wellbeing and their safety. And my background is in farming myself, and before my nursing degree I worked for I won't tell you how long, in speech pathology and vocational rehabilitation. So where I saw the after effects of occupational injury and illness in rural areas and agricultural fields specifically. And so my current role is wonderful because it allows me to focus on preventative health rather than the significant after effects of farm injury, which often last a lifetime. So that's it from me.
Thanks very much, Morna. Appreciate that. Might jump straight into our panel discussion now, and I think I'll just actually stop sharing my screen here if I can, so we can see everyone. There we go. Might start with you, Pip. So, as Director Engagement for New South Wales DPI, how do you define resilience, and what are some of the key messages around promoting resilience that you would like to see producers adopting?
So here at DPI, we treat resilience, it's a process, not really an outcome. And I think it's important to say as well is that resilience can be diminished by difficult times and adverse events, which is certainly what we've seen in the last couple of years. Many challenges for our primary producers. So resilience is effectively, it's the ability to cope with unexpected changes and challenges that happen, whether that's as a personal individual, at a family scale, or even at a business scale. You can't prevent those things from happening, and sometimes, they are completely unexpected, just say the unexpected loss of someone in your family. What resilience is the ability to have that experience and then recover from it. But what is really important is about the lessons you learn from it. So if we think about drought as a good example, looking back for those that are now in the recovery phase of saying, well, what did we learn from that experience? What will we continue to do again in the future? But what also would we change and not do again? And it's that process of reflection and growth that actually is a really important feature in resilience. So the message that I would give to families out there and businesses that are all listening is that it's really important to stop and take that time to do that reflection and think about how you use it as a growth mechanism, because that will help to mitigate those sorts of risks to you and your family in the future. It's not an easy thing to do. It's quite difficult and it's complex because there's many challenges that we have in farm family businesses, such as the way we communicate, where you are in your succession journey, even the stages that you're in your business life cycle, let alone if you've got mental health issues or other more challenging circumstances such as alcoholism, domestic violence. These things all make it very complex and difficult to do. But in essence, that is what resilience is. It's bouncing back, but bouncing forward as a growth.
Thanks, Pip. And have you seen that resilience change through generations, like with young people you're seeing now compared to maybe the previous generation? Is there a difference in the resilience levels in those groups?
I perhaps wouldn't say that there's a difference between generations, but family units that have improved communication in their business and decision-making processes seem to express a stronger level of resilience, and their capacity to buffer challenges is certainly enhanced by doing that.
Thanks very much. Question for you now, Tim, and I think it's something that we spoke last year about actually when we caught up out at Booyah. Just like to get your thoughts on the impact of lifestyle on mental health. Things like sleep, diet, etc. What's the impact that those things can have on mental health?
Well, look, I think that they're really the basic pillars that sort of support good mental health, really. I mean, in terms of, if you're looking to get someone out of even a depressive hole, for example, some of the things that you really need to sort out are the basic lifestyle factors. You want to make sure that their sleep's in the right place, where they're getting the right amount, where they're getting good rest. You want to make sure that they're exercising. I mean, the amazing thing about exercise for mild to moderate depression is it's about as effective as everything else, therapy or medication, which is quite phenomenal. Obviously, a different story when we get into the more severe level of depression, where medication will be much more beneficial. But certainly, the impact of exercise is phenomenal, and also things like diet. Making sure that someone is basically feeling well physically also makes a big difference to how they feel psychologically or mentally. So, if you're giving yourself the right fuel, you're going to have a much better chance of staying well. And I guess the way of thinking about it, if we're sort of using that depression example, the opposite of depression is really vitality. Often people think about it as happiness, which is just not true. Really, the difference that we want to see in people when we've got someone in a bit of a hole and they're quite depressed is we want to get them back into life and have some of that vigor, which is really the opposite. So you have to support those basic, I guess they're the basic pillars of good health generally, but also mental health. I guess mental health is really part of health as a whole thing, obviously. So I think those lifestyle factors are absolutely huge, and even beyond that, things like social connection, in terms of making sure that people are catching up with each other, taking the time to make those phone calls, go out and catch up with people, maybe the neighbours. But those things make a huge difference as well. And a lot of the time, what you're doing with someone who is struggling is actually getting those things back on track. It's quite a simple thing sometimes. Not always the case, but often it's actually about getting those things right. If we can get people sleeping well, we can get them exercising, eating well, and back into their social network where they're going out and doing things. I think that's really important. I think the other thing to add to that, I think it's important for people to have some sort of direction so they feel like they're heading somewhere. And really, I think they're the things that support good mental health and really provide us with a road back to good mental health if we are struggling.
Thanks, Tim. Yeah, spot on. Prue, just a question for you now. Your business pioneered a new online safety induction tool a number of years ago. What was the reason for your business adopting this, and how successful has that been for you?
Yeah, Steve, so I guess this was back probably 4 to 5 years ago now. We were kind of, as a family business, we were looking for ways to actually to structure what we did in terms of our inductions, our safety sort of programming, and make sure that because we had multi-locations across kind of, you know, up to Emerald and down into New South Wales, we could never guarantee that inductions of young staff were being carried out properly. And we just wanted to make sure there was that kind of, I guess, basic foundation tool. So we spoke to a company that was doing some online training videos for the horticulture industry, and we saw that we kind of fitted into that because there was a lot of you know, casual staff, but also a lot of staff without English as a first language. So everything was very visual, and it kind of explained procedures, and you know, basically it sort of was an introduction to working with our business Palgrove. We since then did some work with OB Beef, and I think Darlene's on line today, but to try and extend it out to more extensive type properties as well. So, you know, remote location sort of workplace health and safety issues were covered and things like that. It was kind of that first, it was kind of a first port of call, I think. So we knew that the foundation of induction was properly done across the business, and then each of the managers would then do, you know, more locale type inductions. I guess for us, we thought, well, you know, if this online platform can work for inductions, it can work for a whole lot of other training as well. And I guess it then became what we called our academy, and we could sort of add training to be completed online. And we saw that our staff just really took to it, and that was kind of everyone from the young sort of 20s to the middle-aged management staff. They actually took to it as a platform that they enjoyed learning from.
Thanks very much, Prue. Morna, just on to you now for a question. As an agri-safe clinician, can you tell us about how you think farmers and agricultural workers are managing in the COVID setting generally at the moment?
Sure, Steve. Look, as everyone knows, we have our own issues in Victoria, you know, probably around 500 cases across rural Victoria now with COVID, which is very worrying. And we know that rural access to health services is reduced anyway for many farmers, even without COVID. Other states are perhaps less impacted in better current shape, but we all now know how easily this can change. And I think just like the urban community, farming communities too have childcare, aged care, disability care, homeschooling issues, travel restriction concerns. But on top of that, there are, of course, agriculture-focused issues in terms of things like border crossing, supply chains, abattoirs, activity of global markets, trade tensions, the list just goes on. And they're all on, you know, increasing farmers' anxiety, which Tim will no doubt be aware of. And anecdotally, I think many farmers I've spoken to in the last few weeks are struggling juggling that homeschooling with their farming routines. And many farmers are already used to the concept of their worksite being their home. And we know that a bigger percentage of farming workplaces are small businesses that are primarily family owned and operated, where the directors and managers are frequently the owners and operators. So, you know, there is that experience in terms of, you know, a benefit in this regard to be prepared for this COVID situation. But I think one of the issues we all need to be aware of is the implications with potentially for more children to being on farm unsupervised, and the safety implications of that. And we actually have a podcast on our website that might be of interest to some of your listeners, around quite topical for them at the moment. But I would say generally farmers are resilient, and many are already getting their COVID plans ready to be ahead of the game. And many of the industry bodies are providing lots of really useful checklists to prepare, you know, what-if scenarios. And our website has some links to that sort of information as well. I think Prue touched on the online platform for safety induction, and I think we've recently done a bit of a pilot program offering farmers a sort of mini version of what we normally do at a field day, so a health and lifestyle assessment, but sort of online with some occupational health surveying, and farmers have really taken to that very positively. So I think that's another positive thing that I'm seeing they're taking up that sort of digital platform in the way of both keeping connected and getting access to information about their health and their well-being and their safety. So that's probably what I'd say in terms of getting ready for the COVID sort of scenarios.
Thanks very much, Morna. And just on that safety induction, Delene's been kind enough to put a few resources there on the chat. So there's some really useful links there for anyone that wants to jump in and have a look at some of those. So thanks very much for doing that, Delene. Back to you now, Pip. I just wanted to have a quick chat about getting that balance right between, you know, the legal environment or the regulatory environment and then culture and leadership in terms of on-farm safety and well-being. And how do you think, what's the best balance there, and how do we manage that? Yeah,
look, I think the best outcome we can hope for is where people do all the adoption of best practice without any incentivisation. And if we have to avoid red tape, that's even better where we can. You know, having every single person, whether it's an employee or our own family, home safe and well every single day is the key objective. That's what we're all sort of driving towards, and having people think through what are the risks to the business, what are the risks that we're not willing to even have our own family experience, let alone the people that we're responsible when they turn up to our workplaces. Having these great resources now that are available that are user-friendly, and I think Prue made a really great point about connecting her staff in with something that's more visual rather than lots of words or text. We know that literacy is still an issue in our sector. So I think really matching what we have available to meet those needs is critical. And, you know, where there are gaps and where we do fall down, then perhaps regulation is actually really critical to help solve those. But I think we can all agree that being home well and safe every single day is important universally, and that's where we're all driving towards.
Thanks, Pip. Thanks very much. Back to you now, Tim. I just want to get just a few words from you on just what resources do exist in the bush for people that might be struggling with mental health. I know obviously the city, there's probably greater access to some of this stuff, but just give us an outline of what is available to people who might be operating in remote locations.
Well, really, I think there's more available now than there ever has really been available. And one of the main challenges has been really the access to telehealth through Medicare, which has been quite remarkable, really. So I guess what is available, and it depends on how remote you are. But if you've got a GP, obviously I'd recommend that you go to the GP and then get linked in with a local provider or someone that person obviously suggests. But there is a lot of services actually available. I mean, depending on where you, and I'm obviously speaking from a Queensland context here, there's nowhere really where you can't get face-to-face support at the moment if you needed it, and the wait times aren't large. I mean, there's less of a selection in terms of what clinician someone can see. But I think the exciting thing and what we've seen as a result of COVID, I guess, more than anything else, is that we've seen how effective video conferencing is as a way of developing, great therapy models that work very, very well. And certainly I hadn't sort of had much experience in using that before. I know it had been used for some time. And really what we're seeing there is that people get the same benefit over video conference as they do face-to-face. So that the good thing about that is if you're in a rural area, what that means is that you've actually got access to a much broader pool of therapists that are available. So what that means is if you get one that it doesn't work with, it means you can move to someone else, which was always a problem in a rural context, was that you were kind of stuck for options. So if you went and talked to someone and they were no good or they didn't work for you, then you might not have another option. But that's definitely not the case now. And I think a good way of thinking about seeing a mental health clinician in a rural area is that if you don't like someone, find someone else. I mean, think of it like a haircut. Like, it doesn't mean that you get a bad haircut. It doesn't mean you don't go and get another haircut ever. You go and find someone else who gives you a decent haircut. You've got to think about it in that sort of a way, because people will often go in and they'll go, well, that was crap. That's what it's like. But I think you can really use that example of another pretty basic example in life is that you want to make sure that you're getting the right service, and not every clinician is going to give you the right service. So if it's the wrong person, find someone else. And we are in the in that situation now where we do have access to multiple different people. I always encourage people to go through their GP so you've got someone that can recommend someone, because otherwise it's fairly hit and miss. If you're going on the net and that kind of thing, it's someone with the best dad doesn't necessarily mean that they're the best therapist. So always good to get a recommendation. The other thing I'd say is, there is, right throughout Australia, obviously Lifeline, is a great service. If it's 2 o'clock in the morning and someone's having a really hard time, 13, 11, 14 is a very easy number to remember. And that's, one of the great things about that service, and it's 24/7. And they can also link people in the areas that they're in, so that they'll know where that call comes from. They won't know exactly who's calling, but they'll know the area that it comes from, and they can look at available services in that area. And look, there's a number of great services that are being rolled out, or have been rolled out across rural Australia. There's much more than we think there is. People have this idea that there's no service available. It's just not the case. If people want service, they're going to get it.
Yeah. And Tim, how
Can I just
sorry, Morna.
Sorry, I just wanted to add on to what Tim was saying there. At National Centre for Farmer Health, if people would like to get onto that website, we have some links to telehealth, and we've linked up with an organisation called Listen, LYSN, and that provides some sort of bulk billing. And it also, we've built a relationship with Listen so that those psychologists really understand the factors of farming life and work and how that contributes to poor mental health. So that may be of help for people who are listening as well.
Yeah, absolutely.
Thanks, Morna. Prue, I just wanted to ask you, on the back of your company building safety induction tool and bringing some structure to that, how have you found to be the best measure of safety performance? And do you capture safety performance through that induction or management system? Just on mute there, Prue.
Yep. I'm being very dumb today. I apologise for that.
No worries.
Yeah, look, since we did develop the induction video, we thought, well, if that platform has worked for inductions, it'll work for a whole lot of other things as well. So we've since done, our HR is all online, and we're just rolling out at the moment a WH&S called SAS, Safe Ag Systems program to all properties. I guess once you find that, and it is that transition into a sort of a more corporate environment where we did have mandatory reporting, both monthly and quarterly. And I guess as a family farmer, I didn't realise that corporations, well, I realised they reported, but I didn't realise how important preventative measures were too. And I think that, those sort of lead rather than lag indicators are really super important in workplace health and safety, particularly things like hazard reporting and near miss reporting. So I guess since we sort of, brought that into the culture of our business, that's really changed the appreciation from particularly young employees, that there is a desire to be heard as a young employee if they see something that's not quite right. Whereas I think before that it was always sort of, they were a little bit anxious about whether they'd offend a manager or whatever, and report on those things. So for us, it's that monthly and quarterly reporting on those preventative type, what we call them incidents. That sort of rolls into, I think, with, and you talk about building a safety culture, and it's easier said than done. We very early learnt that measures couldn't be checklists and singly reporting and thinking about things like a construction industry or a mining industry might. We had people who had been family farmers themselves working for us. We ourselves were family farmers. So we sort of had this lifetime of thinking of things that it was either an accident or it was just bad luck, or accidents happen on farms. So there was that whole cultural shift that we had to undertake. And then, some of our longer term staff had to undertake that cultural shift with us. And it really is a shift. It's we had a, we talk very much about our people, and every one of those people, no matter how big we grow, is an individual with families. And we or someone has to ring that family, late in the afternoon or at night or whenever an incident happens to say, well, this has occurred. And when we look around the room at our managers' meetings, we sort of say to each other, well, none of us want to be those people who have to ring and make that call. So you sort of, your measures are one thing and your reporting is one thing, but there is a definite, it's kind of like an emotional, making workplace health and safety an emotional issue within your organisation, and saying to employees, well, look at the guy next door to you. Do you want to be, that one that he doesn't turn up tomorrow, and do you want to be responsible for that? So report those near misses, report those hazards, and I think since we've sort of integrated and consolidated sort of emotion, which is a family farm type thing, in with that corporate reporting, the two are sort of working somehow, touch wood, the two are working somehow to sort of get that messaging across, I hope.
Great. Well, Prue, some really good messages there, and I think the key takeaway there is to focus on your front end preventative measures as opposed to things like your LPI, bar, etc. Yep. as an outcome. Yeah, I think that's a really good point. Just a question here for everyone now, and jump in as you see fit. Is anyone on the panel aware of the new standards for quad bikes and rollover devices? Are regulators focusing on the wrong farm machinery in this instance? The questions just come in from one of our listeners.
Stephen, I'm happy to quickly just
sure.
Hop in there. Quad bikes, and we have this debate, and the same is with horses and helmets, riding horses with helmets or not with helmets, and everyone will have a different opinion. New South Wales and Queensland, we operate in both, and there's a different view of the world there until recently. We have rollover bars and helmets on all quad bikes, but the manufacturers will say that it's more dangerous. It's kind of a little bit of a risk assessment. Your property is different to someone else's property a long way away, or you've got different terrain, you've got different operational requirements, and I think it's a risk assessment for everybody. And it's not just quad bikes, it's for every vehicle, every bit of machinery that your staff operate.
Sorry, Prue, you mentioned horses and helmets there as well, and that seems to be another one that has that element of romance to it, doesn't it? Because it's something that's been done for a long time, and it's a massive part of our industry. And what are your views on that?
Well, and once again, we've sought sort of advice, I guess, from different regulators, and no one can give us a total yes or no. And our staff, half of them will say that it's actually more dangerous falling off a horse with a helmet on because it's heavy and your head hits the ground. We haven't come to an agreement on it yet as a business. We encourage helmet wearing, but we certainly haven't made it mandatory. And I guess there's health experts that have been telling us both are as dangerous as the other when you're on a horse and you're at speed.
Yep. Thanks very much. Anyone else want to add anything to that question?
I'll have just a few points. I think most issues are really fraught. If you talk about rollover protection, some say that it can be a lifesaver, and some say that quad bike manufacturing, they're going to exit the market, has led to switches to people choosing less safe options. I think everyone agrees that whatever vehicle it is, we don't want fatalities and we don't want injuries, and safety measures are really critical. There are lots of ways of looking at safety. So whether it's helmets, mandatory training, licensing, stability testing, engineering, getting evidence about all of these things is really critical. They're all worth exploring. And I think, just helmets alone, as Prue mentioned, is not the only solution. And if I talk to farmers, I think, they're often using a range of different problem-solving strategies when they're dealing with safety issues like machinery. So from just parking the quad bike in the shed and saying, I'm not ever going to use it unless it's a backup, to I'm going to purchase a side-by-side, I'm going to enforce helmet use on all people who come on the property, I'm going to do a risk assessment to see what it is about my particular unique farming situation that might lead to the biggest risk on my farm. I think the key is to changing behaviour in safety broadly, and focusing on encouraging farmers to just not look at the machinery, but as Prue said, all hazards on farm, and see the link between health and well-being and safety. And one other point I'd perhaps like to make is that I think the media is important to look at as well. We have a lot of images, and the way we use language reflects on safety as well. So, we can unwittingly be promoting unsafe practices by sharing and liking media images where we've got children and adults doing unsafe things on farms. So I think we can all play a part in trying to shift that safety culture by just simply thinking about what we see in media and whether or not we see that as normal or something to be changed. Using the right images can really be a powerful image to perpetuate either a safety culture or an unsafe practice.
Yeah, no, really good point. I think it just emphasises that need to get that balance between culture and obviously keeping up with the regulation and regulatory environment. So thanks very much for that. We've got a couple of good questions here from the group online. So Melanie's just asked, as a business owner, can you actually make wearing helmets on horses mandatory, or can you only make it a recommendation?
Yeah, Stephen, for us, as part of your engagement with our business, we, under your contract, we have policies, and part of the agreement is that you will agree to all policies of the business. So yes, you can, or that person doesn't start work with you.
Yeah, no worries. Thanks, Prue. And Jenny's just asked a question here, who's also a member of the steering committee. Interested to know what the panel think as an industry, what we can do to get better outcomes in this area, and what changes are needed. I think Morna might have covered a little bit of that already. But anyone else got any insight into anything else, maybe government or otherwise? No? Pip?
Steve, sorry. And I think sitting on the Sustainability Framework Committee, we always were challenged with this, because all we had in terms of indicator or measurement was fatalities, basically, and they were any reportable incidents. And it's just such a negative way to be trying to improve the industry. And I guess, once again, it all comes from, things have to start on farm. And I think this is, workplace health and safety is definitely driven from below and driven up. Industry telling farmers how to operate within their own businesses, it never seems to really work. And I think, encouraging the measurement. I know Dairy Australia do a sort of a safety, like a safety toolkit or something like that, and anyone from Dairy Australia on here might be able to help out on that. But it's kind of this, it just seems to be a one-stop tool, I guess, to sort of say, well, these are the sorts of things you need. It's all consolidated in there, and even downloading that and reporting maybe that, you've instigated or implemented some of those things, it sort of creates that reporting somehow. And unless we get that sort of, down up, I think we're going to have a lot of trouble in those preventative indicators. And that is those reporting indicators that sort of say, well, look, we're looking for safer ways to do things on farm.
Yeah. Thanks, Prue. Did you have something to add there, Pip, as well?
Yeah, I was going to say, I think as a business owner, it's pretty important to know what are the regulatory requirements that you have. Like they're legal obligations, so it's important to understand those. It's important, I think, to talk to your staff or your family about your attitude towards safety and engage them in the conversation. I think it's really important, especially for employees, to be involved in that and to start making informed decisions. And finally, there's a lot of support to businesses out there to help them put in place the policies, procedures and practices that they want to put in place on their farms. So reach out and use those. There's a lot of free support, and at the moment in New South Wales there's also assistance, well, a bit of an incentive there. You can receive a rebate when you engage in those services. So reach out and use all of the support that's around you.
Thanks, Pip. Yep. And the Dairy Australia resources have now been put in the chat there as well. So if you'd like to access them, that's where they are. Just getting back to mental health, Pip, I'd like to just ask you, in your opinion, is mental health becoming more of a prominent issue in the industry, or is it more a case of we're just seeing more people coming forward and being more open about speaking about the challenges of mental health?
Yeah. Look, if I reflect back to the millennial drought and then to this drought event, I think we've come so far in communicating about the importance of mental health and actually talking about it. So I think that's possibly what makes it feel a little bit more prominent is that we've really addressed a strong community stigma, and we're making it a conversation. I've never heard, in particular, more men actually talk about how they're feeling, reaching out to their mates and asking, are they okay? And actively seeking support. In New South Wales under the DPI, we've got the Rural Resilience Program. We've got staff scattered across the state that are there to help build those networks in communities, and they've all reported very much the same, that we've come so far. So I think it's tremendous that we've actually come so far in addressing what has been a blockage. Probably on the east coast of Australia, we've had some pretty challenging circumstances the last couple of years and compounding situations. So I think people are feeling a tremendous amount of stress and are reaching out to understand how can they address that. And I'm also seeing people being able to articulate when they're feeling stressed, when they're feeling burnout, and then when they're actually feeling those accumulating mental health sort of clinical challenges, whether it's depression or severe anxiety. So the language of mental health is excellent amongst the community at the moment.
Yeah, thanks, Pip. And I guess, Tim, you're probably seeing similar in terms of maybe, in times gone by, you might be, a lot of the flights the RFDS are doing are probably physical injuries, and now you may be seeing more people coming forward around mental health. Is that be fair to say?
I guess the problem we've always had is that people wait way too long to get any help. And that's actually not just mental health, it's actually physical health. People in the bush wait longer to go to the doctor generally. But I guess the change I've seen has very much been more in men talking about mental health, particularly depression. I guess that's been one of the things that's been really well marketed, perhaps, in terms of discussing that. I hear less about anxiety, but certainly depression amongst men has become a topic that people feel much more comfortable talking about. Women have usually been fairly good in terms of, I guess they're probably more emotionally intelligent in that way, but there certainly has been a big improvement in terms of men willing to talk about mental health and also access service. So that's been the main sort of change I've seen over the last couple of years, which has been great. Obviously, there's been a lot of external pressures, and they come out in very different ways for different people, but there's obviously a layer over the top of everything else when you're looking at drought and flood and fires. We've certainly been through a lot, and now COVID as well. But certainly acceptance of the need to look after our mental health has been a really great improvement, which is excellent.
Thanks, Tim. Before we move on to a survey, I'd just like to go around the group again and just ask for some final comments in this area, and maybe one takeaway message that you'd like to leave with us today, if that'll be okay. We might start with you, Morna, if that's okay.
Sure. I think we're just in the last conversation, we've touched on the attributes that farmers have, and I think one of the things that we haven't mentioned is that their involvement in local communities is another really important sort of valuable asset that they have. And we already know that being involved, staying connected within your family, your friendship group and your community increases health and well-being. And we also know that poorer health and well-being can increase the risk for injuries. So keeping connected can help it make it easier to ask for help, but it also allows people to share stories about mishaps, close calls, near misses. And by raising awareness, we can be on the path to focus on safety by changing less helpful behaviours and cultures. And we can also open up that conversation about not just safety, but general health and all of those hazards on farm that we all face, as well as wellbeing and mental health. So you're staying connected with each other and your communities, which you already have great connections with, is a really good first step and an attribute to think of if you're thinking about where to move forward. And I think linking safety, health and wellbeing all together and seeing how that they're connected and one impacts on the other is a very important thing to keep foremost in our minds.
Thanks, Morna. Pip?
Yeah, probably like another little addition on sort of this whole business resilience and wellbeing that we probably shouldn't underestimate as well is the impact of the financial aspect of the business. You know, I've seen plenty of farm families over the last couple of years where the financial pressures are actually impacting their wellbeing and mental health. So just as important as knowing your risks around whether it's workplace and health with WHS, improving how you communicate as a family, but also improving your business acumen is really important. The more control you can have around your financial capacity and the decisions that you get to make, especially when you're under stress, will help you be more in control and feel better about your situation. So, just as important to counter all of that into the big picture.
Thanks, Pip. Prue.
Yeah, thanks, Steve. I think to me a key message is engagement and communication. You know, bringing your staff along for the ride with you, making sure that they're part of the solution, whether it be workplace health and safety or general mental health. And I know a couple of years ago we started including wellbeing or staff wellbeing as part of our monthly reporting, and it got to allow us to have a conversation with them, and quite often mental health within an organisation is reflective of what's going on outside, but you have something in common with those other employees, and so you actually can understand what issues they're facing. So I guess, you know, on whether it's on farm family or corporate, that engagement with every level of staff is just so essential to both.
Thanks, Prue. And finally, Tim, just some last thoughts.
Yeah, look, I think, I think things are pretty basic, really, in terms of making sure that people are getting to meet those basic needs, really, in terms of making sure that we've got those strong social connections. And I think most of us are sort of aware of what makes things go along smoothly for someone. I mean, if there's bullying happening on your property or one of your properties, you know that's going to have a negative influence on your workforce. It's all fairly straightforward stuff, and it's not like it's a very complex issue. You want to make sure that that those things that actually just support us generally. I mean, you talked there about finance. Obviously, that's going to have a huge pressure on people. And I guess the other thing to think about here is that what we're really not talking about is mental health problems. We're not really talking about these. All these things we're discussing are really problems in life. Like, they're dealing with pretty severe challenges, and I think we really need to keep that in mind, is that that's what we're dealing with. We're not dealing with mental health conditions. We're dealing with hard situations. And people are going to need some help to get through those. And I think that's an important thing to keep in our minds, that that's what we're really dealing with. To think about it as mental health conditions is probably the wrong way of thinking about it. It's just hard situations that people are dealing with.
Thanks, Tim. Yeah, great words. I'd just like to share a survey now. I'll just share my screen. That the instructions will hopefully be up here. So you can open your browser and type in the sli.do, enter the event code ABSF 3 and answer the survey. It'll show you the results as you go through there, I think, but people can also do that in their own time, I think. So the other thing I just wanted to quickly mention is there's been a few people mention on the chat here about the resources people have posted, and we'll do our best. I'll speak to Jacob, maybe if there's a way we can collate that into one place or one document, so that all those resources, which are all fantastic, are there in one place. And I'm sure there's many more, but thank you to everyone for posting those documents up there. Jacob's sharing the survey results there, so you can see that on the screen. So yeah, thanks again to everyone for participating. I really appreciate everyone's time. Thank you to our panelists. Each and every one of you have brought some real insight into the whole area of mental health and wellbeing, which is such an important area, and an area that's going to continue to remain important in our industry going forward. So thanks again for donating your time and for your insights, and thank you to everybody for taking part. So unless there's anything else, happy to sign off and let everybody carry on with their day, and I hope it's a good day, and we'll catch up soon.
Stay safe.
Thanks, Steve.
Thanks a lot. Cheers.
Thanks a lot. Thanks, Steve.
Thank you.